sexually transmitted diseases, or so STDs or STIs, sexually transmitted infections. This is page 161 in your textbook. Just kind of an overview is these are infectious conditions, bacterial, etc., that spread through intimate contact, sex. They can be given from mother to fetus through blood, through direct contact, through during the birth process, even from breast milk. It depends on the disease and the type of contact. So most people that get diagnosed with STIs are people that are doing things that would help you get STIs. So it tends to be young people that have more and varied sexual partners. They are probably much more sexually active than their seniors, or as they will be later in life. Half of the infections happen between 15 and 25-year-olds. It's saying here in your book, each year 19 million Americans contract an STD. And it's estimated at least 1 out of every 4 sexually active people is carrying an infection other than HIV. That's frightening, isn't it? That 1 in 4. So both these books agree that it's 19 million in the U.S. per year. I have no idea why the U.S. has the highest rate, but apparently it does. So we've talked about AIDS as and that's really an STD. We've talked about herpes as the STD. We actually haven't talked about hepatitis B and C, but we can, and I think this is the perfect place to do it, rather than do it as a separate video. So hepatitis B and hepatitis C are really blood-borne, but they can be transmitted sexually. These are the two that are most at risk for healthcare people, because we're around blood, we're in intimate contact with people from that point of view. So this is the one that dental hygienists worry about because of blood. This is the ones, the hepatitis are the ones, that and HIV are the ones that we're most worried about. Now hepatitis B has become less of an issue because there are vaccines. If you have the Twinrix vaccine, you're vaccinated against it, and so you're pretty safe. It's hepatitis C that is really the big thing. So accidental exposures to hepatitis C from needle pricks and that kind of thing, it cuts with sharp instruments and that kind of thing is really the big problem, and there is no vaccine against it. So really, you have to be very careful about cleanliness and being careful with it. Transmission can also happen sexually, and so that's why it's considered part of the STDs. The use of condoms is, barriers help prevent it, if that's the case. So chlamydia, gonorrhea, and syphilis are the ones that are kind of the big three that we'll discuss. So chlamydia literally means cloaked, hidden. So it's a big problem because women generally don't exhibit symptoms. So women are asymptomatic. So how many women actually have chlamydia? We don't really know, because it's really hard to gather statistics because people don't go for treatment. It's probably more diagnosed accidentally, or diagnosed because they've given it to somebody who then gets the guy gets diagnosed, and then he goes back and says, well, I only had one sexual partner and that was her, so I must have got it from her, sort of thing. So it's bacterial. So it's Chlamydia trachomatis. The diagnosed cases is almost 1 million a year in the U.S. But they think that that's less than a third of them. So go figure. So the bacteria live in the goblet cells. They live in the mucus-producing cells in the columnar epithelium. So that's anywhere where there are mucus-producing goblet cells. So reproductive tract is huge: mouth, throat, around your anus, your nose, places like that. Now, it can invade other places, and in women, big problem is if it ends up in the uterus and the fallopian tubes, the uterine tubes. What happens is inflammation of those tubes end up scarring them and making it almost impossible to get pregnant. So it's cloaked, it's silent. There may not be any symptoms. If there are symptoms, there can be a slight discharge, but again, there's a lot of things that can cause discharges. Maybe some painful urination. A lot of people think they have a bladder infection. Painful intercourse. If it gets up into the pelvis and you get pelvic inflammatory disease, then it becomes systemic. Fever, abdominal pain. It ends up in the lymph nodes, and so you get BOBOs, inflamed lymph nodes. And it may develop into scarring and infertility issues. Because this scarring affects the cilia of the fallopian tubes, then things don't move through the fallopian tubes as quickly as they should. And since most fertilization happens in the fallopian tubes, the risk for ectopic pregnancy actually goes up. Now, there was a problem for a long time because this wasn't diagnosed, and it wasn't really diagnosable for a long time. One of the things that can happen is that as babies leave the uterus and pass through the cervix and past the mucus goblet cells of the cervix, they can get this bacteria basically on them. And one of the places that it affects is the conjunctiva of the eye, so they can end up with a bad conjunctivitis and maybe blindness. Babies will also, on their first breath, maybe breathe it in, and it can affect the lungs, and they can end up with a pneumonia from it. So before antibiotics and before good diagnostic tests were available, and we're only talking the 1940s and 50s that antibiotics were available for civilians, many jurisdictions passed laws that said that newborn babies had to have silver nitrate, which is basically an acid, drops put in their eyes right after birth when they take the baby to the side and do the Apgar test. And they would put drops in their eyes and literally burn the uh, outer layer of the conjunctiva off before the bacteria could get deep into the tissue. So they just take off the first layer, and it's painful, and it causes temporary blindness. It's a pretty traumatic way to enter the world, and it was the law in Ontario right up until the late 1980s. You know that all babies had to have it. So how do they figure out that you have it? Well, first off, you have to suspect that you have it, and then they'll culture as if there's a discharge. So they take a culture and they look. The good news is that there really isn't antibiotic resistance. So antibiotics are very effective with it. Once they diagnose this, you're fine. Now, for whatever reason, and I have my own theories on this, and they're just more thoughts than facts, but I'll share them with you. You don't develop immunity against chlamydia. And my thought is that because mucus cells, the goblet cells, are exocrine, and they are found in epithelium, which is avascular, and they secrete to outside the body as in exocrine, that these bacteria never really get into your body to trigger the immune response. That they are somehow not there to where the immune they can't be eaten by the antigen presenting cells. So they last a long time, and you don't develop immunity or immunological memory to them. Okay, so the clap, gonorrhea. The bacteria that causes it is Neisseria gonorrhea. It's kind of frightening that we're looking at 1/3 cases a year that are reported, and that's probably about half of them. You get it through intimate contact with somebody who has it, and it's saying intimate contact invades throat, vagina, and rectum. It kind of all depends on what you're doing. One of the problems with gonorrhea is that it can become systemic and spread to other tissues and give an arthritic sort of condition. Now, another thing that happens with these, and we're going to see it later, is reactive arthritis. And reactive arthritis is usually following an STI, and it's an arthritis of an autoimmune origin at a site distant from where the infection was. So there's a reactive arthritis called Reiter's arthritis that usually follows gonorrhea or chlamydia infections. So gonorrhea, it ends up with discharge. They call it the steady drip of gonorrhea. Sometimes in women it's silent. It's a little bit like chlamydia, but there's usually more of a discharge, a malodorous discharge, painful urination, painful intercourse, sores in the mouth and throat if that's where the disease is. Painful urination and a discharge are the most common things in men, but you can get orchitis, which is inflamed testes from it. Complications are infections, spreading, increased risk of HIV because of your immune problems, Risk of pelvic inflammatory disease if it gets up in through the fallopian tubes. Yeah. And so how do they diagnose it? They culture the discharge from wherever the problem is. Now, big problem with it is that there are various antibiotic resistant strains, and gonorrhea is one of those things that the antibiotic development, it just seems to be one step ahead of the new strains of it. So not all antibiotics are working. So far, there are none that are totally resistant to antibiotics, but it's getting harder and harder to treat all the time. Syphilis is caused by a spirochete. It's a lot like Lyme disease. It's not as prevalent as it once was. We're down to, it says 8,700 diagnoses per year. It's really, in the greater scheme of things, that's not a lot. It spreads through sexual contact, or it can spread mother to child, especially during childbirth. What it doesn't do is live outside the host. So you can't get it off a toilet seat. You can't get it that way. It pretty much has to go from host to host. Once you get the infection, the first part of the infection is local, but then it goes systemic and it travels through blood, and it affects virtually everything: joints, blood vessels, bones, the central nervous system, heart. It's kind of all over the map. It's often called the great mimicker because the signs and symptoms look like a lot of different things. It may be misdiagnosed for a while. So there's basically three stages of it. There's the primary infection, the secondary infection, and the tertiary infection. So in the primary infection, unfortunately, it doesn't happen right away. You have sex with somebody who gives it to you. It may be 3 months before the symptoms of the primary infection show up. It could be as little as a couple of weeks, but it may be as long as 3 months. And what happens is you get an ulcer at wherever the issue is. So penile ulcers or vaginal ulcers, mouth, wherever the infection has invaded. At that point, super contagious. It's difficult because at that point you might be super contagious, but women especially may not be having any signs and symptoms. There may not be a discharge, so that's where the danger lies, I guess. And then this canker, this open sore, this ulcer, heals over and goes away. So it's like, okay, I haven't been active for months, and now all of a sudden I got this open sore, I don't know, that on your privates, and that's pretty scary. Geez, I hope it goes away. Oh, 3 weeks later, yeah, it's gone. Dodge that bullet. And then you get these intermittent things, comes and goes for a couple of years. It's the secondary infection. And you get these brown sores on the soles of your feet, the palms of your hands. And it's just these intermittent sores. The sores can be contagious, but this is a lot of times the stage that it gets treated at or found at. You know, the primary one is where you hope that people will go and get treatment. The secondary one is difficult, and this might go on for years, really just on and off, um, and then it goes away, and does it becomes latent or it progresses to the tertiary disease, pretty much the same as Lyme disease does. You know, some just go latent and aren't bothered by it again, and then others it becomes tertiary. And in the tertiary infections, the bacteria go to other systems. In the tertiary syphilis, it's not contagious anymore. There's no open source. You're not shedding this stuff, but it ends up in other tissues, in your blood vessels, in your central nervous system. It can cause stroke or blindness or hemorrhaging. Can be some nasty stuff. It can cause long-term damage to organs, including the brain. It's saying that it increases the risk of HIV transmission. There's a complication that if the mother has it, she can give it to her child, right? In the past has been a real scourge. It's been a terrible thing because of this tertiary nature of it. But now it's not such a big deal because it responds very well to penicillin. It's very easy to diagnose. It's very easy to treat. You go in to see the doctor and you got an open sore on your pee-pee. If it looks like syphilis, you're going to get treatment, and you should be okay. If you don't get treatment, you can end up with long-term, irreversible damage to a lot of different organs, specifically heart and brain and kidneys. Those are the ones that I think cause the most problems. So various other things would be things like non-gonococcal urethritis. So it looks just like gonorrhea. It's inflammation of the urethra. It's bacterial in nature, but it's not Neisseria. So that's it's a bit of an issue, I guess. Trichomonas is actually a protozoan. It's like Giardia. It's sexually transmitted. It has a lot of the same sort of symptoms, causes inflammation and a lot of the same symptoms as the other STDs, except that it's not a bacteria, it's a protozoan. There are viral infections, and the big one is HPV, human papillomavirus, genital warts. The big problem with this is the fear that it leads to cervical cancer. Right now, there's a vaccine that's effective for about 4 of the different types of genital warts, and they're the ones that are most associated with cervical cancer, and it's become recommended that girls in grade 8 get that vaccine for that. So the only way you're not going to get an STD is to abstain from sex. When we're looking at 1 in 4 people being carriers of STDs, it's a pretty frightening statistic here. That's one of the reasons why they say you can't have a party without a balloon. Condoms work at preventing these things. but there could be other skin to skin contact. It could be from kissing, could be a lot of different things. You know, it's one thing to try and prevent gonorrhea by using a condom, but if the other person has that infection in their mouth, you've kind of got an issue there. You don't want to go near any open lesions when you're massaging. So, and if people are forthcoming about their STDs, then you want to discuss it, and you're going to want to monitor at that point. That's STIs.